Francis report of the Mid Staffordshire crisis outlines an investigation into the practice of medicine in the Mid Staffordshire Hospital between 2005 and 2009. The reason this report was significant is that it, one, highlighted some significant issues with the quality of care that patients were getting. There were some terrible stories in the way that care was being delivered in this hospital. And two, once those issues had been identified, it highlighted a few systemic issues that were going on in the NHS at the time. So in one of the previous videos about the NHS structure and the organisations, we mentioned how it's a state-funded system. However, within that, there is an attempt to create competition between the CCGs, the clinical commissioning groups, and the NHS trusts. So the government pay these trusts, or the CCGs, to deliver the service, and they compare different CCGs across the country to see who's performing well. And there are metrics that they have to meet to do that, and that's a way of creating competition within the system. The Francis report found that between 400 and 1,200 people could have died unnecessarily between the years of 2005 and 2008. There were issues such as call bells for patients in the bed for the nursing staff to attend them not being answered, patients left lying in their own urine or excrement, food and drink being left out of reach of patients who couldn't grab it for themselves. Sometimes they ended up becoming dehydrated. I think there was even a report of patients actually drinking water out of the vases of the flowers that their friends and family had delivered to them at the bedside, due to the fact that they'd been so dehydrated and left without support for so long. Patients falling ill being concealed from the relatives, not enough consultants or nurses, and poor communication between the staff in the hospital and the patients' families and the patients themselves. The first report that was published in 2010 found that there was historic understaffing of the nurses, and that was one of the number one reasons for the poor quality care. The second report was published in 2013, and that looked at how the setup of the entire healthcare system in England could have contributed towards this situation. And it found that in this particular trust, the trust was so focused on the metrics and the targets, such as quick discharges or seeing patients in A&E, or whatever the metric was for the hospital to perform at. They were so focused on that, and the hospital managers and the staff in general were so focused on their metrics that they lost sight of why they were there in the first place, which is to deliver high quality patient care, to make sure that patients are treated well, safely, kindly, and effectively. The report then came out with 200 recommendations, including increasing staffing levels, protecting whistleblowers who want to escalate concerns about the way that the organisation is running, eradication of blame culture and bullying, training and regulation of healthcare assistants, and recruitment and training of the standards of registered nurses. So there were a lot of recommendations for improvement from this report, and quite often when questions come up about issues that have happened in the NHS, it's not exactly always the particular details of the issue itself. It's usually more how the NHS responds to crises. So what happens when a big institutional crisis happens? Well, the government are capable of launching independent investigations where the investigator isn't beholden to any particular political party or external influences, ideally. And this allows for transparency and a leveled approach where the objective facts are looked at and a assessment or recommendation is made off those facts. So it can be good to be aware of this particular crisis, but it's also good to be aware of plenty of other crises such as the COVID-19 pandemic and the other hot topics that we mentioned in here. So the government responded at the end of 2013 after the report was published by looking into the recommendations of the report and included actions for improving the care that the patients received. So they gained increased openness and changes in the regulation of the hospitals. For example, the government recommended that from the following April that all hospitals would publish their staffing levels on a ward-by-ward basis, and it would show a percentage of how many of the shifts are meeting safe staffing guidelines in both the nursing staff and the doctors. And finally, NICE responded by liaising and discussing with the Department of Health to try and create guidelines on what safe staffing levels are within hospitals.